Hi, everybody. Welcome back to the CHHA 2021 National Conference. We are virtual, and so far it's been a real strong musical theme with Justin Osmond and with Marshall Chasen as well. But we're going to switch gears, go in a bit of a direction, and an important direction, in my opinion, and that is mental health. It's such a hot topic. Pre-pandemic and magnified 100 times, 1,000 times now that we're in the middle of a pandemic, and it affects everybody differently, and it certainly affects anybody with hearing challenges. And I think this segment is going to be awfully valuable when it comes to that subject matter. Captioning and understanding the links between hearing loss and mental health with Sheila Serap, Dr. Jennifer Deal, who's in Baltimore, Maryland, go Ravens, and Dr. Carrie Scarf. Loved playing in Calgary, always lost to the Stampeders, but not a big deal. Individuals wait on average 10 years before getting help for hearing loss. Research from Johns Hopkins University has found this out. And by this time, communication has become difficult. Isolation and health risks increase, and cognitive processing declines. Now, this workshop, moderated by Sheila, she joined us. She was here yesterday with us and did a fantastic job, and will do so again. The focus will be on how delays in diagnosing hearing loss can affect processing skills. Now, as mentioned, Dr. Carrie Scarf and Dr. Jennifer Deals could join us. Carrie is an audiologist who practices audiology at Innovations Limited in Calgary, and she's going to discuss the latest research on how delaying diagnosis or hearing loss impacts cognitive function. And that sort of dovetails from some of the stuff we talked about yesterday. And Dr. Jennifer Deal, assistant professor at Johns Hopkins Bloomberg School of Public Health, is going to share some news on her research on the intersection of hearing, cognition, and aging. That's a lot there, and I'm going to let them take it from here, and I'm going to just join the audience and absorb what they have to share with us. Ladies, the stage is yours.
Thank you, Ken. I'd like to thank everyone for joining us today in this workshop and to better understand the link between hearing health and hearing loss and mental health. So I just heard yesterday in one of the workshops, and we've heard from other sources, it can take up to 10 years for an individual to seek help or identification of hearing loss. By this time, communication has become difficult, isolation and health risks increase, and cognitive processing become affected. Our guest speakers will share with us the latest research about the impacts of delaying diagnosis of hearing loss. I'd like to begin by asking Dr. Carrie Scarf the first question. Dr. Scarf, how does delaying hearing diagnosis impact on auditory processing skills?
Thank you, Sheila. So first, I think the first important thing to do is to really share that and make sure that people understand there are changes to our processing abilities throughout our lifespan, particularly to our auditory processing skills. And those are the ones that I'm going to be discussing a little bit today. So just naturally growing older actually has an effect on our auditory processing and our overall brain processing, and hearing loss also has an effect. So let's first clarify what we're talking about with regards to auditory processing. So auditory processing includes things such as listening to speech and noise, following rapid speech or accents, and even remembering what we hear. So thinking about our auditory memory. Our auditory system, surprisingly to many people, isn't actually fully developed until approximately ages 14 to 19, depending on the individual. And how do we know this? We know this from how our brain responds to different auditory stimuli. When we do electrical, they're called evoked potentials. So once developed, we have a pretty good run of auditory processing skills for a few decades. However, this processing ability then changes again as we age, particularly after age 35 to 50, depending on the individual, independent of whether we have hearing loss or not. So human colleagues reviewed this in a great publication in 2012, and they reported research showing that older adults suffer central processing declines that make it harder to follow a speech stream in background noise, basically as we age. Okay, so these changes in how our auditory system processes sound, it affects our listening comprehension and our speech understanding, particularly in challenging environments. And that's what we just kind of have to remember. The world is full of challenging listening environments, whether there's noise, whether there's people speaking quickly, whether they're speaking with an accent that has a different rhythm than what we're used to. So there are also examples in children too, of what happens when auditory processing is challenged. So in noisy classrooms, for example, they have a lot more difficulty dealing with listening to speech in a noisy classroom before about age 14. And this makes perfect sense because, of course, as I alluded to, their auditory system hasn't fully developed and isn't quite as capable of filtering out background noise and focusing on the speech and the sentences that they want to hear. Then, like I mentioned, by age 35, we start to have this difficulty again, and you might have experienced this yourself, people in the audience, in the real world, as an example, where you go to a pub or a restaurant and you're having more difficulty hearing and picking out those things you want to listen to when you are in that challenging environment. So this deterioration in auditory processing happens on its own as we grow older. Now, what's important, as Sheila alluded to, if we have hearing loss, there are more auditory challenges, and the research is clear. The average person waits between 7 to 10 years to do anything, even when they realize that they have some hearing challenges. And interestingly enough, there's some even more surprising information on that note, Sheila. So in 2012, 2013, the Canadian Health Measures Study reported that of the people in their statistical research that showed hearing loss, so for example, 48% of Canadians over age 60 have some hearing loss, 18% of adult Canadians have some hearing loss. Of those people who have hearing loss, a full 70% of them were unaware that they have that hearing loss, because hearing loss is generally gradual. So not only do we not necessarily take action when we know we have hearing loss, but it even goes further back to the point that we might not know we have hearing loss. So it just points to the fact that we need to really encourage the identification of hearing loss, because people aren't necessarily aware that they have it. So like Sheila mentioned, we often wait far too long to take action, 7 to 10 years. We often don't even know we have hearing loss. Why is that important? It's important because it will affect our auditory processing ability. As we're aging, the brain is changing, and if we have hearing loss, those auditory processing skills are challenged even further. So I just want to touch briefly, the last point I want to make on this question is why auditory processing changes happen when we have hearing loss. And this goes back to the brain. So the brain changes in a few ways. First of all, we know that untreated hearing loss shows recruitment of the auditory cortex for other modalities, to use those cells for other things like vision, for example. And this could become permanent. And in some new recent research from Sharma and Glick in 2020 in Frontiers of Neuroscience, they showed that this recruitment of areas of the brain that used to be used for the auditory system and then get used for perhaps the visual system will affect our ability to understand speech and perceive speech. Okay, so the brain changes what it's being used for if it's not being used for the initial reason. Secondly, we know that untreated hearing loss can lead to a reduction in activity at the auditory cortex. So that's some of the research that was done at Johns Hopkins Medical Center by Dr. Frank Lin and his colleagues. And what they showed was that this can become permanent also, particularly after 4.5 years of not being exposed to the proper auditory stimulation. So you know, back in, I think it was 2012 or 2013, when Dr. Lin published this research, and many people were really astounded by the fact that the auditory cells can actually permanently atrophy if they're not getting the proper stimulation. But his research really followed historical research that we've been doing for the last several decades, almost 40 years, which was called auditory deprivation research. We didn't necessarily know the reason that people had difficulty understanding speech after they had hearing loss for so long. And we didn't necessarily have the detail to look at it at the brain that Dr. Frank Lin and his colleagues did, but we knew that there was deterioration and permanent deterioration of what we call word discrimination or speech perception if we had long-standing hearing loss that we didn't do anything about. So it all fits together like pieces in the puzzle. And then lastly, the other reason um, that we see changes to auditory processing if we have hearing loss is that we have to use more effort. If we have untreated hearing loss, so we haven't done anything about it, and we're having difficulty in noisy situations, well then researchers such as Pecora, Fuller, and Dr. Gurjeet Singh and others from the University of Toronto, for example, have shown that we have to use more effort, and using these cortical resources and pointing them towards helping us understand what we hear means we don't have as many resources for other important cognitive activities. Um, so a long answer to your question, but certainly if we want to avoid potential permanent detrimental effects to our auditory processing, so important things like being able to understand what we hear in different kinds of environments, then we should really be very careful with identifying hearing loss as soon as we can and seriously considering receiving treatment that is offered to us by healthcare professionals and hearing care professionals. Thank you very much, Sheila.
Thank you. And to follow up on what you were saying, I'd like to turn to Dr. Jennifer Guillaume. Dr. Guillaume, can you discuss the relationship between hearing loss and dementia in population studies?
Thank you. Hello. Thank you so much, Sheila, and thank you to everyone for the invitation to be here. I'm really happy to be here. So in terms of findings from population studies, they really tell us a consistent story. And what they tell us is that hearing loss in older adults is associated with faster rates of cognitive change and with increased risk of dementia in population-based observational studies. There was a recent meta-analysis that's conducted, and that's just a fancy word for a study that summarizes the findings from a lot of other studies. And the studies they looked at were all what we call prospective studies, which just means that we enroll individuals and then we follow them forward in time. And in this case, the follow-up really ranged from between 6 to 18 years. And that study found that hearing loss was associated with faster rates of decline, and that's in multiple domains. And so that included memory, it included processing speed, as well as global cognitive function. And I think an interesting point for us to keep in mind is to recognize the way that we measure cognition in these large studies. And many of the tests that we use require someone to be able to hear. So for example, in a memory task, I may read a list of words and I may ask the participant then to remember as many words as they can. And so clearly we have to be able to hear in order to complete that test. But what's important is that we know from several studies that have looked at the relationship between hearing and cognitive decline, what we see is that the relationship persists. So hearing is still related to cognitive function, even when we don't use tests that require someone to hear. So we exclude tests that rely solely on an auditory administration. So for example, instead of reading that list of words, maybe I would provide that list of words written down on a piece of paper and then ask an individual to remember as many words as they could. And in that type of study, on average, participants who have hearing loss will still remember fewer words than people who have normal hearing. Additionally, there's been a lot of work in terms of thinking about dementia in population-based studies. And so in 2017, The Lancet, which is one of the world's oldest and most renowned peer-reviewed medical journals, they had a report that was published on dementia prevention, intervention, and care. And then they updated that report last summer in July, so in July 2020. And overall, they found that hearing loss was associated with a 94% increased risk of dementia, and that risk of dementia increased as severity of hearing loss increased. So by that, I mean people with a moderate hearing loss are at greater risk of dementia compared to people who have a mild hearing loss. And in fact, in that report, hearing loss was estimated to contribute the greatest proportion of risk compared to any other risk factor. And so that includes things like high blood pressure, diabetes, physical inactivity, things that we know are bad for your health and can lead to dementia. And it was estimated that overall hearing loss may lead to 8 to 9% of dementia cases in the world. And part of the reason why that number is so high is just that so many older adults in the world have hearing loss. So, we talked about over 50%, over 55% of adults who are over the age of 60. And by the time we enter into age 70 and above, it's estimated that every 2 out of 3 older adults will have a clinically significant hearing loss. So I would like to highlight just a couple of things. And so first, I want to emphasize that we have a lot of research that suggests that hearing loss is related to dementia, but we don't yet know if hearing loss causes dementia. So it's associated, but we don't yet fully understand why. And it may be that hearing loss causes dementia, but it may also be that there's some other factor that can cause both hearing loss and dementia, like cardiovascular disease, for example. And so in that case, hearing loss and dementia may seem to be related, but they're not. They're not actually related. So we're still trying to figure out why we see that association. The second point I'd like to emphasize is that the studies that I'm referring to have all looked at age-related hearing loss. So that's the gradual loss of hearing that occurs as we age. And so we don't yet know about the relationship between other types of hearing loss and dementia. So for example, a congenital hearing loss or a hearing loss that's been present since early childhood. That type of hearing loss may have a very different relationship with dementia, and so we don't yet know what that relationship is. And then finally, I would like to talk just a little bit about the interpretation of those studies. So I mentioned in the Lancet report that the increased risk of dementia that's associated with hearing loss is 94%, and that seems like a lot. And when we're used to thinking about percent risk or percent chance, we're used to thinking about it kind of like we do the weather. So if we were to wake up in the morning and either turn on the local news or take out our smartphone and open our favorite weather app, we may see that there's an 80% chance of rain. But an 80% chance doesn't mean that it will rain. And in fact, in terms of raining, it's going to either rain 100% yes, or not rain, so then it would be a 0% chance. And so the chance it will rain on any given day is not 80%, it's either 0% or 100%. And the same is true for the way that we interpret the results from these types of studies. An individual will either develop dementia, that's a 100% chance, or they won't develop dementia, a 0% chance. And we don't know for a given individual until it actually happens. And so the interpretation from these types of studies means that on average, in a population, individuals who have hearing loss compared to individuals who have normal hearing are more likely to develop dementia. But it doesn't mean that just because you have hearing loss, you will develop dementia. So not everyone with hearing loss develops dementia, and some people will develop dementia even though they don't have hearing loss. Just like we know that high blood pressure contributes risk to a stroke, but not everyone who has high blood pressure will experience a stroke. So we have quite a bit of evidence to suggest that age-related hearing loss is related to dementia and cognitive decline in older adults. But importantly, we're still learning why. We don't yet understand the mechanisms. And we don't yet know if treatment for hearing loss can prevent or delay cognitive decline and dementia in older adults.
Thank you. Dr. Scott, would you be able to share with us some of the activities that you recommend for people with hearing loss to improve or retain auditory cognitive processing?
Sorry. Absolutely. Thank you, Sheila. This is a great question, and I get this question a lot. So I want to go through a little bit of the research and then a little bit of the kind of day-to-day recommendations, what we can take from what we know in the research and apply it to real life. So first of all, the evidence is very, very clear that if we want to ensure good auditory processing and hence good cognitive processing, we need to first improve our hearing. If we are not hearing the world the way it really, really is, that's doing us a disservice, and that will absolutely affect our auditory processing capabilities. So we need to get as much high quality sound up to our auditory cortex as we can. So it's important to take action on hearing loss if you or someone you care about experiences hearing loss and hasn't done anything about it. That's step one, is we need to get the proper sounds, get the ears assisted in the proper way to get the information up to the brain. But secondly, certainly there is some emerging evidence for at least some positive training effects with regards to helping retain or improve auditory processing. So there are several commercial options. Some of the ones you might have seen online are things like Clear, which you can find online, clearworksforears.com, LACE, which you can find online, neurotone.com, brainhq.com, and now a new one that I'm pretty interested in, I'm going to be trying myself, that Dr. Nancy Ty Murray's group put together. It's called Amplify. And so most of these are computer-based. Well, they're all computer-based, but most of them are now app-based, gamified training with both listening skill and cognitive practice. In terms of auditory skills, they look at comparing and distinguishing between letters of different words, sentences, and also in different levels of noise with different voices. In terms of cognitive skills, the things that they provide for practice would be things like practicing paying attention to sounds, remembering sounds, and processing sounds more quickly. So those things are available, but what do we know from the research? So very recently in 2020, Dr. Marin and colleagues did a review of some of these commercially available auditory processing training procedures in the ear and hearing review. And they found that more improvement was seen in new hearing aid users, that those training systems that included both auditory and more general cognitive training seemed to show more positive outcomes. And some of the outcomes that they saw were things like improving cognitive skills, like working memory, for example. But according to some of the leaders in this area of research, so people like Dr. Kelly Tremblay from the University of Washington, Dr. Nina Kraus from Northwestern University, among others, definitely more research and good quality research needs to be done, perhaps with more intensive training programs. What they did find in the review that I alluded to earlier was that the involvement of a hearing care professional actually seems to help with the outcomes, probably simply because of positive reinforcement, but it did seem to help. And we need to look at some other things too. So although the research is not, I wouldn't say it's in its infancy, it's still certainly emerging, and we are awaiting really good quality, larger, long scale studies with more intense training protocols and follow up to see if any effects that we do see are also long lasting. So you can certainly investigate some of those things online, definitely with these types of listening training gamified systems. I don't believe any harm would be done by choosing to get involved with them. They're kind of fun. They also make patients aware that, which I like as a audiology clinician, it makes patients aware that what they do can help their hearing function in different environments. It's not just about a piece of technology that's going to do everything for you. We should also practice good auditory processing in our day-to-day activities. So ensuring that we keep up with our day-to-day listening skills is crucial. This is important now more than ever before, where people are in quiet situations more and more. It's important that we don't get used to living in silence. We need to immerse our auditory system in sounds. And so in this regard, there's really simple things you can just be aware of by listening to music, listening to podcasts, recorded books, radio programs, movies and TV, and even YouTube videos that you can learn things from. So each one is going to have different levels of background noise, which is good. You'll have a good chance to hear different voices that you're unfamiliar with, which is very, very good for auditory processing. Some other things that you can do that are easy is to have telephone conversations with people familiar to you, and then be sure that you keep practicing answering the phone with people that may be unfamiliar to you as well. It's important that you hear different voices that you're not that familiar with. Take part in listening conversations on Zoom and Skype. I had one patient tell me something really creative. She said she does cooking online with her granddaughter over Zoom, and they talk back and forth and they read through the recipe, or they're both following the same recipe. So that was a really great opportunity to keep up auditory processing skills. Also, don't be afraid to try tools to assist you. It's not just about hearing sounds, it's about hearing sound appropriately and correctly. So there are some tools available to help you distinguish what you hear more accurately, such as closed captioning. So you can watch TV and listen to the audio of the program. Don't only rely on the closed captioning, but use it as a backup mechanism. So if you miss a letter or miss a word, you won't miss the whole sentence and the whole conversation, for example. Try out some speech to text apps. There are some good free or very inexpensive ones online to help people. If you're in a grocery store and the person is talking with a mask on behind a plexiglass barrier, you can just point your microphone towards the person talking, and it will live caption that and convert it to text. And at the clinics that I run and own, called Audiology Innovations, I often give my patients some auditory rehabilitation homework. So, we have to think about treating hearing as a holistic event, really helping the people hear better at the ear. But also, with this evidence that's emerging, that's out there, we need our patients to be aware of that. And so I often will give them a little bit of homework that they should watch TV with closed captioning for an hour a day while they're wearing their new hearing aids, for example, or make sure that they have at least 20 minutes of phone call work with friends or family or grandchildren with their new hearing aids, just to get that auditory processing stimulated, and also so that they become confident with listening in different environments. So really important that if somebody goes out to get hearing care, they're working with a clinic that's going to provide the hearing care in a holistic manner, where it's not just about technology. And that's what I love about this seminar today, is that we're looking at the brain, we're looking at auditory processing, and we know how important that is to make better use of hearing aid type technology if we have hearing loss. Thanks very much, Sheila.
Thank you. These are really invaluable activities that we can do. And I know for myself, with everyone wearing masks, I've really practiced trying to listen, really pay attention. And in this process, I've realized that everyone is in the same boat. We're all trying to hear, and with just a little bit more patience. So thank you for those wonderful activities that we can all do every day. Dr. Dion, I was hoping that you would be able to share with us what we know and don't know about how treatment may impact the association between hearing loss and dementia.
Thank you, Sheila. The short answer is we don't know. We don't know if treatment can change the association that we see, but we are working to find out. So we're conducting some studies right now that hopefully will lead us to an answer. As I mentioned previously, there are a lot of older adults who are impacted by hearing loss. And so we think that hearing loss may be, the greatest modifiable risk factor for dementia. And it's estimated that up to 8 to 9% of dementia cases are due to hearing loss. Um, but we don't really understand why we see this relationship. And so I'd like to start out by talking a little bit about what are some of the reasons why we think hearing loss might be related to dementia, because it's important to understand those pathways if we think that treatment is going to have an impact. Um, so if hearing loss is associated with dementia, but it's due to some other third factor. And so we talked about this a little bit before. So that in that case, dementia and hearing loss may seem related, but it's only because they're caused by the same thing. And so the example I gave previously was cardiovascular disease. That certainly is one potential reason why we might see a link between hearing loss and dementia. That is not causal. They're just correlated. There's just an association. Increased levels of inflammation in the body is another reason why people think that hearing loss and dementia could potentially be related. That's not causal. And if that's the case, if it is something like cardiovascular disease or inflammation or some other process that we typically ascribe to an aging process, then we're out of luck. If we treat hearing loss, we won't be able to do anything to prevent dementia, because if we treat, in order for treatment to have an impact, dementia or hearing loss actually has to cause dementia. But we do think there are some pathways that may be causal. And so the first pathway by which we think hearing loss may lead to dementia and cognitive decline is called cognitive load. And so I'm going to oversimplify a little bit, but not too much, and say that we can think about hearing as occurring in two steps. And so the first step occurs in the ear, and the second step occurs in the brain. And so when sound comes into the inner ear, speech, for example, the job of the inner ear is to encode that sound. It transduces that sound, it transduces that speech, it encodes it into a neural signal, and that signal is then sent to the brain where it's decoded. So step one, we have this encoding of sound in the brain or in the ear, and step two is we have the decoding of sound in the brain. When we have hearing loss in the ear, when that sound is encoded, it's not crisp, it's not clean, it's not a sharp signal. Instead, it's garbled, it's degraded. And so when that degraded and garbled sound goes to the brain, that means that the brain has to work that much harder in order to decode it. And so if you know someone who has age-related hearing loss, that may be why they may say something when they're having difficulty hearing. They may say it sounds like mumbling, because it's not just a matter of not being able to hear, it's a matter of clarity of that signal. And so that garbled, degraded signal can require extra processing effort in the brain. And if it does, that may come at the expense of the brain doing other important tasks. For example, like encoding that speech into memory. And so that's what we call the information degradation hypothesis. So it's the idea that the brain has to devote extra effort to decoding a garbled signal. Additionally, and Dr. Scarf gave us a preview of this and talked about it earlier in her first answer. Another reason why we think hearing loss may cause dementia or cognitive decline is that it may actually directly impact the brain structure and function. And so we're able to look at the brains of individuals when we put them into what are called magnetic resonance imaging or MRI machines. And in these neuroimaging studies, we can look at the brains of individuals who have hearing loss and individuals who don't. And what we see is that in individuals who have hearing loss, even outside of the part of the brain that's devoted to hearing, and that part of the brain devoted to hearing is called the primary auditory cortex, we see that there are parts of the brain that light up outside of that area in people who have hearing loss compared to people who don't have hearing loss. And so what that tells us is that the brains are probably working that much harder. They're recruiting additional networks to help compensate for that degraded acoustic signal. And so if I were to just maybe put that a little bit more simply and to summarize, I would just say, you know, individuals with hearing loss may need to use more of their brain to decode that signal. And as Dr. Scarf so beautifully pointed out earlier, it may not just be that we're recruiting outside parts of the brain. It may be that the part of the brain that is supposed to be devoted to hearing no longer is. That other parts of the somatosensory system have recruited that part of the brain for their use, like vision. And so what we have seen when we look in large population-based studies is that on average, people who have hearing loss compared to people who have normal hearing, there is smaller brain volumes, and there's also faster rates of atrophy in the brain over time. And that's specific to the temporal lobe, which is where that part of the brain that's devoted to hearing sits, but it's also in the whole brain overall. So we don't really understand everything about what this means, but it gives us some clue that hearing loss may impact the brain even outside of the primary auditory cortex. And then finally, another possible mechanism by which we think hearing loss might cause dementia is it may lead to increased social isolation or increased loneliness. And social isolation and loneliness we know are really important. They increase risk for cardiovascular disease, and they increase risk for mortality, and that's both due to cardiovascular disease as well as all-cause mortality. And so we know what's good for the heart is also good for the brain. And so if something increases risk for cardiovascular disease, it may also increase risk for dementia as well. So there are some pathways through which we think hearing loss might cause dementia and cognitive decline. In terms of the direct evidence that we have that have looked at whether hearing aids or hearing treatment can change that relationship. So I'll say that there have been a number of studies that have looked at this. They've all been observational studies. And what they have found has been consistent. And that tells us that hearing aid users, compared to people who have hearing loss but don't use hearing aids, for those who use hearing aids, that's associated with slower rates of cognitive change. So that's consistent. It tells us that treatment may help. But I do think we have to be cautious when we interpret those results. So I mentioned those are observational studies, which means that we recruit participants into our study and we observe them and follow them over time. But what they choose to do, whether someone chooses to get a hearing aid, is completely up to them. And we know that many people who could potentially benefit from hearing aids don't use them. So the estimate is that about 20% of older adults who could potentially benefit from hearing aids use them, which means that 80% of older adults who could potentially benefit do not. And there are many reasons why this might be. So in some countries, hearing aids are not covered under universal health care, like the United States. In that case, there is a very high cost. In the United States, the cost of a pair of hearing aids may be the third largest purchase for an individual, second to a home and a car. So they can be very expensive. We also know there may be some stigma associated with using hearing aids. And we also know that some people may think that hearing loss is something that's just normal, that happens with aging, and it's not something that really needs to be addressed. And so regardless of the reason, what that means is that people who use hearing aids are quite different from people who don't. And on average, people who use hearing aids tend to have a higher socioeconomic status. They tend to have higher levels of education. They may have greater access to healthcare. And all of those factors are really important because all of those factors protect against dementia. And in an observational study where someone is themselves choosing whether or not to use a hearing aid, we have a really hard time disentangling that effect, right? What's the effect of the hearing aid compared to what's the effect of all those other factors that kind of track with whether someone chooses to use a hearing aid? And so for that reason, we need a stronger level of evidence to really determine whether hearing aids can help prevent dementia or cognitive decline. And so the type of evidence we need is a randomized controlled trial. And we're in the process of conducting one right now. It's called the Aging and Cognitive Health in Elders, or ACHIEVE study. And we have recruited 977 older adults. They were all aged 70 to 84 years at the time of recruitment. They all had a mild to moderate hearing loss and were not treated. And then we randomly assigned them to receive either a best practices hearing rehabilitation intervention. And so that included hearing aids, as well as rehabilitation that was really centered around their personal hearing goals. Or they received a health education control. And we are in the process of following them up over time. With the COVID pandemic, unfortunately, we were delayed for a little bit, but we are on track and we expect to have results from that trial in 2023. So at this point, I can't say, we don't know if hearing aids can prevent cognitive decline or dementia, but I hope in 2023, I'll be able to give you that answer.
Thank you very much, Dr. Deal. This is invaluable research knowledge that we hope to share with members. One of the tenets of CHAR is the value of self-help. And part of this self-help is becoming knowledgeable and informed about the research underway. And it's so exciting to hear the research that is underway to better understand loss and to better equip ourselves with assisting ourselves as well as our friends and family. And thank you for undertaking this research, and we're really excited to learn about this as it goes forward. We just have a few more minutes left, and I would like to ask both Dr. Scarf and Dr. Deal if they have any tips on how we can be proactive with our loved ones, with our friends, to assist them in addressing delays in diagnosing hearing loss. Dr. Scarf?
Thank you, Sheila. So yeah, that's a great question. So I'll just briefly say a couple things. You know, there's a lot of research linking hearing loss and, you know, well, like Dr. Deal mentioned, it's correlating hearing loss with changes to cognitive function. But there's also research that shows untreated hearing loss is related to other things as well: higher risk of falls, higher rates of depression in seniors. So those types of you know, research studies would be good for your clientele to look into. The other thing that we find really, as from a clinical perspective, is that people have better relationships. And actually there is research on this too, but with their family, with their friends, with their spouses, with their children, once we address hearing loss. So that might be a motivating factor. And then, you know, besides those kind of educational and informational pieces that can be motivating to some people to potentially take action, there's also the emotional side. Like, I think it's important that people really think about the pandemic and how we've been restricted in how much we can communicate in person with people. We've become much better at that now using technology, but you know, not having communication and losing parts of our communication is really detrimental. So have the person that you care about, have them think about what is important to them. This is what I ask my patients every single day. Tell me the 3 things that are most meaningful to you that you're able to hear. And it's amazing. People come up with different things. Sometimes it's music. Sometimes it's their spouse. Sometimes it's their grandchildren. Sometimes it's hearing nature sounds like birds. So if they can think about some of the sounds that they love and they want to continue hearing correctly, that might be a way to help them think about moving forward and taking action.
Thank you, Dr. Scarf. Dr. Deal, is there anything you could suggest briefly? And then
Thank you. I think it's hard to improve upon Dr. Scarf's response. I think that was wonderful. You know, we don't know yet if hearing aid treatment can prevent some of these other adverse outcomes like dementia that we've been talking about, but we know it can improve communication and we know it can improve quality of life. So there are definite benefits to hearing aid treatment, and people who adopt hearing aids earlier tend to do better than people who wait. So from that perspective, certainly the sooner the better.
Thank you very much. I know that these were hard subjects to delve into. They are important for all of us and for our families and friends. And thank you very much, Dr. Scarf and Dr. Gill. And I just want to express our appreciation for the research and the work that you're doing to advance knowledge and research so that we can be proactive in addressing hearing loss. Thank you very much.
Thank you.
I want to add,
Thank you.
if there are any questions from members, please email them to info@shaw.ca. Thank you very much.
Thank you, Sheila, and thank you, Carrie and Jennifer. Well done. If we could, and I will make arrangements as well, because Jennifer and Carrie, you shared a significant amount of information, and there are studies out there, and there's interest. People would like to review these studies, and so if we can get that information out there to the audience as well, that would be great. And I think Shannon will help get some of that information. I'm not sure if the links are available at hand right at this moment, or if you can get them to them, but it's like good news. Carry lots of momentum, and you have lots of good news in terms of your studies and how you can increase, at the end of the day, increase the quality of life for so many individuals and make their journeys far more rewarding than angst ridden. So outstanding work. And Sheila, well done once again. We really appreciate your time. We're going to take a little bit of a break, and we're going to reconnect at 2:55. For some of us, we have kids who are in school. I know I do, virtual school, so I have to get them transitioned from school to the afternoon, what they're going to do for the rest of the day. So we're going to give you a chance to do that and maybe get yourself a beverage. And again, we'll reconnect at 2:55. So we'll chat then. Thank you.